Basically, the guys, what they use is a pneumatic air chisel that is also to gain access, but through sheet steel. If there is an area where they have to gain access into, but there is no need for jaws or shears at that moment, they can use the air chisel, which is also powered by air, as said in the name. It looks like a very blunt chisel in the front, but they'll use it to, especially on the side of the door, or to get into sheet metal on the side to gain access to a patient or a certain object inside of the vehicle. That's what can be used. It's a safe tool to use once you understand it, but also paramedics have to take special precautions on that. Getting it set up is far more quicker, but you can't really compare it. The reason being is that it's a completely different tool. It will not pry a door open where your spreaders would do that and your shears would be able to cut maybe one piece of steel from another. It's limited into what it can cut. For instance, it won't cut through chassis. It's because of very hard steel. So then you'll move over to different types of hydraulic, where hydraulic is much more powerful than air. Basically in that, what they use is there's different tools, depends on where you have to gain access. When you've seen earlier when they have to remove a roof of a vehicle or gain access, it's powered electrical, so you have to have a generator, especially for the ripsaw, where they can use a ripsaw just to cut around either the B pillar, A pillar or C pillar to remove the roof of that vehicle. It is also a dangerous tool, but with enough safety precautions and training, you'll be able to master the tool. The problem with that is that if you do not apply correct techniques, your risk of blades being dislodged and also the patient inside of the vehicle. So most important is always tell your patient what's going on inside. Same with the ripsaw, which can go through the glass, front windscreen, rear screen, depends on where you have to gain access to. You can use that along with the grinder, especially if it's a big body of steel, for instance with trucks, where the front cab is so smashed and you have to gain entrance from the rear. In airbags, for us to see airbags deploy firsthand is really a fascinating factor. It's also a very good training tool, because most of the times when paramedics arrive on the scene, airbags have already been deployed. If not, we protect it so it doesn't deploy. To see that it actually deploys, you can see the damage it causes, the mechanism of it, and also it will help us in training in the future to understand why patients have this type of injuries. In one of the scenarios we've seen actually a patient that was slumped forward with not having a safety belt. The amount of facial damage a patient could get from an airbag being deployed without having a seat belt. So that is very important to us, and also with us helping it to move around it. Once an airbag is not deployed, to make sure that we cut into different areas not to deploy the airbag, and also remove the battery connectors, so in order to also avoid it from deploying accidentally.